Good evening and welcome to another panel discussion on the 19th edition of the Assembly of ECOWAS Health Ministers Meeting. I am Fatou Ellika Muloshi, and today again with me in the studios I have this high professional delegation that are here to be a part of this general meeting. So on my left, I have the Director General of West African Health Organization, Professor Stanley Okolo. You're welcome to the
Thank
program.
you so much, Fatou.
Yes, and on my right, I have Mr. Mamadi Cham. He is a Gambian health expert. You're welcome to the program. And on my far right, I have Dr. Berili Esotuma. He is a Togolese health expert. You're also welcome to the program.
Thank you.
I welcome you all to this discussion. First of all, I'd like to know what has been going on so far with regards to the meetings that have been happening. Dr. Mamadi, you'd like to update us?
Thank you very much, Fatou, for inviting us for this meeting. So far, the meeting started with the liaison officers of the various 15 countries in the ECOWAS region.
Okay.
Then that was on the 4th, on the 5th to the 6th was the health experts who met to look at the documents that the ministers will deliberate on.
Okay.
And today, the 7th, we have the forum for health partners.
Okay.
And the main show is tomorrow, where the health ministers of the ECOWAS region will converge in Gambia for the meeting.
For the meeting itself. Thank you very much for that update. Now, Professor, I'd like to know, considering the fact that ECOWAS in itself is very particular about the economic growth and development of its member states, what has been some of the economic advantage of the West African Health Organization?
The West African Health Organization is charged with collating and bringing together the health policies of the countries, trying to strengthen the networks of the countries, working with various people with the particular goal of maintaining to the highest standards the health of the population. Now, in doing this, what we are also trying to do, or what we have done so far, is that, for example, when we have epidemics, like we had the Ebola outbreak, we had in DRC, but the one we had here only about 3-4 years ago, we had in Liberia, Sierra Leone, and Guinea, you were aware that that had a tremendous economic impact on the population and also in the region. And it was because the West African Health Organization galvanized support, galvanized all the regional resources to come together in terms of helping fight that. That is one of the areas. The other area in which we're working in, which has tremendous, so first and foremost is to say that health and improving the health of the population has a major economic impact. But in terms of definitive and specific things that we're working on, one of the things we're looking at is the quality of pharmaceuticals and medicines that we have in our region. And we really think that if we could get the conditions right in terms of having regional manufacture of drugs within our region, not only will it achieve the security and quality of medicines, but it will also be a nidus for industrialization in the pharmaceutical factor. So there are several areas that we are working on. Even though it's to do with health and well-being, it does have a tremendous impact on the economy.
Very well, and that actually brings me to the question of, has there been any plans of producing medicines locally in the sub-region?
Yes, we have had several plans. We have harmonized, for example, the pharmaceuticals in terms of the regulation, the policy across all 15 countries. We are working with the United Nations International Development Organization, and I was at UNIDO in Vienna a few weeks ago, where we signed a memorandum of understanding to help our pharmaceutical companies to continue to meet the good manufacturing GMP specifications, but also so that we can get to the stage where there will be regional manufacturing. At the moment, we have done an assessment of many pharmaceutical countries, almost all pharmaceutical companies in the region, and we know that there are some that are on Class A, some on Class B, and some on Class C. What we now need to do over the next over the coming months is to actually get on board the platform for us to start indigenous manufacturing. There is one small step that still needs to be done, which is the
But there has not been any step taken just yet.
No, the steps have been done because it's all in stages. So we have gone through the stage of assessing them, the stage of equipping them, the stage of harmonizing our regulations and policies, so that when the drugs are manufactured, we don't have to have specific regulation and barriers between countries. Training people. So the investments that will come then, and we are hoping will come, once we have reached the stage of making sure that the companies that will be in the first phase do have pre-qualification with WHO, so that they can also export their drugs outside. That's the next stage we'll be in.
There will be a huge breakthrough. And that brings me to Dr. Leweli. Now, let's talk about the impact of WAHO in Togo as a Togolese health expert.
Merci. Alors, l'OS, c'est l'Organisation Ouest Africaine de la Santé, c'est WAHO en anglais. Il faut dire que c'est une organisation qui apporte son appui sur tous les aspects liés donc, aux questions de la santé. Et comme le directeur général vient de le dire, il y a tous les domaines concernant la santé de la mère et de l'enfant. Il y a les domaines concernant la lutte contre la maladie, les épidémies, les urgences sanitaires. Il y a les maladies endémiques comme la tuberculose, le paludisme, le VIH-Sida. Et l'OAS nous appuie dans tous ces domaines pour améliorer l'état de santé de la population. Alors, parallèlement à ça, il y a les autres problèmes liés aux maladies non transmissibles. Vous savez, on cite par exemple les maladies cardiovasculaires, l'hypertension, le diabète, tout là. Alors, l'OAS nous appuie fortement dans ce domaine parce qu'aujourd'hui, c'est une réalité. Cette maladie constitue un vrai problème de santé publique parce que la mortalité est très élevée. Et vous savez aussi, dans le domaine de la vaccination, à travers l'OAS, tous les pays de la CEDEAO, et donc mon pays, reçoit chaque année un appui pour augmenter la couverture vaccinale. Des efforts sont faits, mais il reste encore à faire. Et notre présence ici depuis le lundi, c'est pour faire le point donc de la situation de l'année 2017. Voilà pourquoi les points focaux se sont réunis le lundi, comme l'a dit Dr. Thiam, et ils ont essayé d'examiner un certain nombre de dossiers qu'ils ont soumis aux experts que nous sommes. Et nous, à notre tour, le mardi, mercredi, donc nous avons examiné donc, le rapport 2017 de l'OAS que nous avons validé, qu'on va soumettre donc, à l'Assemblée des ministres demain, de la Santé.
I think he had made mention of malaria and all of those things. I'm not quite fluent in French, so I cannot really say what actually he is saying, but I think
but I can help you.
Yeah.
And he was trying to explain that WAHO is an important organization for Togo, and that WAHO has been supporting Togo not only in terms of some of the programs in some of the areas, including things like malaria, tuberculosis, HIV, and it's also talked about the meetings that we have had, and the fact that we have had some documents that were discussed at the experts meeting, and that previously we had the focal liaison officers meeting, but that all those documents have been reviewed by the committee that he chairs. Even though he's the expert from Togo, he is the chair of the committee of experts of all the 15 countries, and the outcome of those deliberations will be presented to the ministers who are meeting tomorrow.
Okay, thank you very much for that comprehensive explanation. Now that brings me to Dr. Mamadi, as the health expert of Gambia in the WAHO. What are some of the areas you think that needs to be discussed at the General Assembly meeting with regards to the health sector?
Thank you. I think what needs to be discussed has already been tabled for the,
we'd like to know.
For the ministers.
Yeah.
And one of the things was, just as the Director General has mentioned, about local production of medicines in the ECOWAS region. It will be noted that the ECOWAS countries spend huge amount of money to purchase drugs out of the region, which only is not expensive, but also it takes time before the medicines arrive in our respective countries. So having a manufacturing company here within the sub-region, which is accredited, will help not only reduce cost, but the lead time for drugs to be available. The other things that the ministers will be discussing is also how public hospitals in the ECOWAS region can be made to be more effective to address the needs of the ECOWAS citizens. It could be noted that every year up to estimated to be over $1 billion is spent by ECOWAS citizens on overseas treatment out of the ECOWAS region. So if our public hospitals are so effective to respond to the public health needs of our population, that money will stay within the ECOWAS region. The other area that the ministers will be discussing is about laboratory. You see, nowadays we've moved from this syndromic management to diagnostic management of ailments, where the capacities of laboratories should be so developed to be able to make the correct diagnosis. Let's foresee during the incidence of the Ebola outbreak in the sub-region in 2014. Most of these countries don't have the capacity, laboratory-wise, to diagnose these things. They have to send the laboratory outside, and that takes time in the diagnosis and also in the management of the cases.
So
there are a lot of...
you're talking about in terms of developing the health sector of the sub-region.
The health system of the sub-region.
Of the sub-region. But has there been any substantial or concrete steps that have been taken already to better this sector?
Yeah, I think if you look at...
Because we definitely cannot compare our health resources or facilities to the West, but have there been any concrete steps or projects that have been in place?
Yes, we are not comparing between developed and developing countries. But one thing we need to understand also, in the sub-region, there are very good success stories which we need to sell, and immunization coverage is high in some of these countries. The Gambia is an example. Cape Verde and other countries which, through this public health intervention, disease outbreaks of certain communicable diseases have been nipped on the bud in some of these countries. To some of the ailments that were being treated out of the ECOWAS region, we've seen that between cooperation between and amongst countries of the ECOWAS, it could be done there. It could be noted that in Gambia, a lot of people go to Senegal for treatment. This is through the platform of ECOWAS. It needs to be formalized so that it's just like goods and services move between borders. Patients also move between borders.
I think that should be made cheaper then, if that is one of the agreements.
These are some of the things. But you know, health is dynamic anywhere. It's not one bullet that kills all. We need to keep on changing. Diseases have been changing the way, and also the neglected diseases are coming up, and new diseases are coming. So that is why the health experts come to look at what are the challenges facing the health sector. And WAHO, over the years, I think it needs to be mentioned here. During the Ebola outbreak in 2014, even though Gambia was not affected to have an Ebola case, but WAHO took it upon itself to help us, to support us in a mobile laboratory vehicle. And that is helping us. And also develop protocols and guidelines.
How efficient has that been?
Well, we use it to move up country to when there is any outbreak, for the laboratory personnel to go and use it, transport specimen from the rural to the urban area. That reduces cost and also cut the lead time to diagnosis and treatment.
Very well. Thank you very much. You'd like to add anything on to what he has said?
He has said most of the things that we're doing. One of the things that I would like your viewers to be aware of is that we have the charge to ensure that we maintain the highest possible standards. And it's not just the epidemics and infectious diseases, but there are things that cause a lot of deaths in our society. Things like what we call non-communicable diseases, but for the layman it means cardiovascular disease, hypertension, strokes, and all these things that affect us. Things like women dying in childbirth, which is a tragedy in our countries. In our region, information, up to over 500 women out of 100,000 die in childbirth. That is really a tragedy.
What has been
that
some
is
of the
a tragedy.
that
and so there are best practices that have been happening in countries, some of them to change behavior, some of them to strengthen access to high quality healthcare, some of them to improve standards with our traditional birth attendants and first responders, and some of them to develop the capacity of people to respond to emergencies. And we are now talking about what we can do more. Then what of children under 5 who are dying in huge numbers? And there are some simple things that we can bring along, some of which have been done in trials in Niger, in Tanzania, and in Malawi, showing that there are simple things that we could do to improve under 5 mortality. Then we mustn't forget the fact that there is a drug problem among some of our teenagers at the moment and adolescents.
That's important.
And you know, so we are really looking across board. And the other aspects that are really key for us is thinking about what we do with health information. One of the things we are looking at setting up is a health observatory for the ECOWAS region. Because once we have that, we can, and it's operationalized, we can then ensure that we gather all the pieces of little information or data, as we call it scientifically, that we will put together, analyze it, to be able to look at, focus on the hot areas, know what is specific for our region, and be able to advise the countries, but also not just advise, support them, strengthen the relationships, what we call networks, so that we will be able to continue to sustain this. The final thing that we mustn't forget is that there is a need for us in short while to start doing things ourselves. And that means that whatever programs we're doing with our excellent funders, and I must pay tribute to various companies, various countries that are taking their money of their citizens and the taxpayers to come and support us. But we must ensure we build capacity so that we develop our people to start taking on some of those roles. And that is really important.
It's very important. I mean, you talked about data, but how has use and surveillance data helped in preventing certain disease outbreaks in the sub-region?
Well, what it has done to some degree at the moment, at the stage we're in, is not necessarily preventing outbreak, but it's preventing spread, so that once there is, so there is rapid response in terms of any time that we'll have. So for example, there was the question of Lassa fever in some of our countries, and then sometimes we have issues in terms of yellow fever, and we immediately, so for example, part of the thing that happened with the current ongoing Ebola in DRC Congo is the, it's because of that. It's because of the data, and we were looking at what was happening in terms, and WHO was, which is taking the lead, the World Health Organization is taking the lead. Exactly. And so they collate, put together all network of institutions that will always analyze this and then advise the individual countries on what to do in terms of surveillance. And that is critically important. It's critically important.
You would like to add anything on that, Mr. Mamadi?
Yeah, but I think there is a platform when all countries of the West Africa Health Organization report on weekly basis. And this weekly reporting helps countries to be alert of events that happens beyond their borders. And this, when this data is being pulled, it helps. At WAHO, there is a focal person for every thematic area. And as such, they can respond. And countries, if they need help, the dashboard can show which country is in need, and they respond effectively.
Wow. Wow, we need thumbs up for that. That's really, really interesting. I mean, that actually brings me to the question of, since we're about to wrap up, what has been the importance of the General Assembly meetings that the WAHO has been having?
Several things are the critical importance of it, but for WAHO as an organization, it is a time to take stock. It is a time to do a report of the past year's events. It is a time to discuss programs going forward, particularly with our technical experts who advise us on what they feel are the individual needs of the countries and how we blend it and align it to our 5-year strategic plan. And this particular year is important because we have come to the Gambia, given what is happening in the Gambia following following your democratic transition recently. We feel that it's a show of making sure that we show our support for the people of the Gambia and for your government. And also the ECOWAS team are a new team. So I have only taken up leadership of WAHO since March this year. And so all the ECOWAS commissioners have been. So this is my first of the assemblies, but it is a very important time for us not only to review what we're doing, but for us to take advice from our experts and for us to prepare for going forward. And the chair of the experts committee might have something to add.
The chief of the expert committee wanted to add something on that, yes.
Yes. Alors, je voudrais donc, comme le DG vient de le dire, l'occasion qui nous a été donnée cette année pour cette assemblée, il n'était pas programmé un point qui a fait l'objet de discussions, que je veux bien ajouter. Il s'agit de la question des accidents de la voie publique, les accidents de la circulation. Donc on en a discuté, c'est devenu un problème de santé publique. Ce n'est pas une maladie, mais lorsqu'il y a accident, il y a traumatisme et donc la personne peut perdre sa vie ou bien la personne va être reçue à l'hôpital, va sortir avec des séquelles, incapacité, invalidité, ainsi de suite. Alors il est question vraiment qu'on va soumettre au ministre pour que les pays vraiment puissent se pencher sur la question et mener des actions allant dans le sens de réduire les accidents de la voie publique dans nos pays. Parce que pour parler d'un accident, avant qu'il y ait accident, il y a trois facteurs. Soit c'est lié à l'homme lui-même, soit c'est lié à l'engin que nous conduisons, le véhicule, la moto, ainsi de suite, ou c'est lié à la route. Et lorsqu'on veut mettre ensemble les trois facteurs, on se rend compte que c'est surtout le facteur humain lié à l'homme. Et donc, il faut qu'au niveau de la sous-région, la réglementation puisse être vraiment revue et être appliquée, passer à la sensibilisation, punir lorsque vraiment il y a non-respect donc, de la réglementation. Et en ce sens, ça va vraiment diminuer drastiquement le poids des accidents de la voie publique.
Okay, there's a huge task.
So yeah, he was talking about the fact that apart from the public health programs we have talked about, that there is also the question of road traffic accidents.
Exactly.
And the road traffic accidents are things that are causing a lot of deaths in our population. And that we did discuss this, and we talked about the fact that it is multifactorial, but we want to bring it to the Assembly of Health Ministers so that it comes to the high visibility of the countries and the political actors. That there are three things definitely that are important, whether it's a problem with the vehicle, a problem with infrastructure like the roads, or a problem with the behavior of people, and that it's important that we really tackle that issue and factor it, because there are, in some of our countries, where policies have been taken and actions have been taken, it had reduced the incidence of road traffic accidents and deaths from road traffic accidents.
That's true, very true, and thank you very much for raising that there. So now we talk about, since we are wrapping up, we'll talk about what are some of the plans that are in place for the sub-region in terms of the health sector.
The first thing is to try and consolidate on all the gains we've made. We have a lot of strong networks in various areas. The second is to start picking up some of the public health and best practices to scale it up on population level so that it goes across the population. And the third, I know we're running out of time, but we also have to think about how we ensure that whatever we do has an impact on the population of the people. And I will just leave it there because we're running out of time.
Thank you very much, Director. That was the Director General of WAHO, and we also had a Togolese expert and a Gambian health expert. Thank you very much for being with us today here in the studios. Thank you very much. That was all we had for you on this panel discussion of the 19th edition of the Assembly of ECOWAS Health Ministers Meeting. That was all we had for you. I've been Fatou Ellika Muloshi. Till I come your way next time, have a wonderful evening.